but you'll be able to use that for everything.
David Moncada is meeting with a counselor at Family Health Centers of San Diego. He's in their intensive outpatient program for drug addicts.
One of the rules I chose was to have 5 years or more sobriety.
A few years ago, Moncada was a homeless meth user who frequently got arrested. Things changed when someone from Family Health Centers visited him in jail. They convinced him to enroll in a program run by the city attorney's office focused on breaking the cycle of incarceration for low-level drug offenders. When he was released, Moncada got a ride directly from jail to the health clinic. He says from there, they made it easy.
Their access was centralized, so they made my appointments with my therapist. They made my appointments with my psychologist. They made an appointment to get a physical, so I started getting back into the health plan. There's no way I would have picked up the phone at the time and been like, I need to make an appointment and I'm not going to stay on hold.
It's this kind of intense hand-holding that Moncada says helped him stick with his recovery. And it's the kind of work Family Health Centers will soon do more of, thanks to a $300,000 grant funded by California's cannabis taxes. The grants were promised as part of the 2016 ballot measure that legalized pot, and they're prioritized in communities most harmed by the nation's decades-long war on drugs. But despite sales of recreational pot being legal for 2 years, many of these programs have been delayed because of lack of funding.
The state is missing out on tremendous amounts of tax revenue.
Dallin Young is political director for the Association of Cannabis Professionals. The industry estimates up to 80% of California's pot retailers are unlicensed and untaxed. Young says the main reason for this are the bans or severe restrictions on legal sales imposed by local governments.
So right there, that creates a lot of access deserts, so patients cannot get access to any of these products because their jurisdictions don't allow them.
Cannabis shops are notoriously difficult and costly to open in San Diego. The city has fewer than 20 licensed retailers open for business. Denver has more than 8 times that number, with less than half of San Diego's population. Young says if San Diego wants more cannabis tax revenue, it has to allow more businesses to participate in the legal market.
I think that it's very prudent for our local governments to take out the moral judgment of whether or not cannabis is right or wrong, good or bad, and focus on the benefits that could be gained from this type of revenue that the state is going to be giving to these communities.
About that grant program, San Diego County did not compete very well. It received $1.25 million, or about 37 cents for every person in the county. Meanwhile, other large metro areas, including LA, Sacramento, and Oakland, got between 3 and 7 times as much money per capita. Dallin Young says local officials could have done more to drum up interest in the program.
We haven't seen quite the leadership that we need throughout the entire county to really inform the nonprofit groups that are doing the work that that grant program would facilitate with. They're not communicating with them, I don't feel like, and they're not really pushing them to apply for those grants.
A spokesperson for San Diego County's Public Health Department said the agency considered applying for the grants, but opted not to because of restrictions on how the money could be spent.
As soon as I took that first hit of marijuana, I knew I was an addict because it helped me with the struggle of losing my dad when I was a young kid.
David Moncada talks about how his path to addiction started with marijuana.
And then it progressed from smoking weed in high school to drinking alcohol in the high school. I had my first DUI when I was 18, underage drinking.
There's some irony in the fact that the legal cannabis industry is now funding programs to help people like Moncada stay off drugs. But Moncada is fine with it.
The funding should be there. You know, once the people get in recovery and they get stabilized, they're less likely to be offenses caused to get them incarcerated.
Tune in tomorrow for a look at cannabis equity programs, which aim to help disadvantaged populations share in the profits from legalized cannabis. Andrew Bowen, KPBS News.